Welcome to our video segment today. I would like to address a frequently asked question with you, which greatly concerns patients. It is the question about the failure rate of an extension. Unfortunately, this question cannot be answered briefly or generally, as it depends on many factors. When we consider an extension as a whole, the successful completion of an extension must first be correctly defined. In my opinion, this is achieved when one reaches their extension goal, ideally has returned to their previous athletic form, no long-term damage has occurred, and no serious complications were suffered. Thus, answering the question spans several areas that we need to consider separately. On one hand, we have the operation itself. The successful execution of the operation is, of course, a prerequisite for the extension, and it includes the surgical cutting of the bones, the implantation of the nails, as well as the anesthesia. Here, complications can occur with any operation regardless of the procedure. These are very rare, but they must be explicitly addressed during the consultation. We then talk about classic surgical risks such as infections, bleeding, nerve or vascular damage, fractures, or thrombosis. I will address these points explicitly in further video sequences and provide information on the individual risks. I will give percentage indicators so that you have a good understanding of the likelihood of these risks. The next relevant point that determines the success or failure of an extension is the implant, its mechanism, and the material. The mechanism of the Betz bone is purely mechanical, without seals or electrical components. This provides extreme security regarding the failure of the extension function. Additionally, the Betz bone is made of non-ferrous material, which excludes complications such as corrosion and the associated inflammatory reactions up to the dissolution of bone. External interference factors that cause a halt in the extension due to material failure are extremely rare. Nevertheless, material failure must also be discussed during the consultation. Explicitly, also the behavior during an extension. Jumping or aggressive sports should not be performed during the extension. All of this can lead to material failure and thus to the failure of the extension. The last point is sometimes the most important for the success of the therapy. This represents the extension of the soft tissue structures and the associated stretching work. The patient is responsible for this themselves. Of course, they receive full support from the Becker-Betz Institute. However, it must be absolutely clear that the actual stretching work, gait training, and prescribed exercises must be carried out independently and properly. This work is fundamental for the success of the treatment, as it lengthens the soft tissue, i.e., the lengthening of the corresponding muscles. Thus, the patient is primarily responsible for whether the extension is successful or whether they do not achieve their set goal. It can therefore happen that a patient does not reach their goal and the extension is not achieved, and they must stop a few centimeters short, even though the operation went wonderfully and without complications and the nail functions perfectly. For this reason, the question of success or failure is always also a question of one's own structure, discipline, and a good and realistic plan.